Welcome, everybody. This is really exciting because this is the culmination of decades of work. And as you're going to learn tonight, these are dual products whose time has come. Just like we take daily supplements to keep our vitamins and minerals in our cells, we now need to figure out a way to caretake our hormones because our dirty planet is assaulting our hormones. So we want to have daily hormone protection against our dirty planet, which is filled with chemicals that are endocrine disruptors. What does that mean? That means hormone disruptors. So just like we take supplements, we're going to need to have daily hormone protection. And if you are interested in these products, you can go to my website, drlindsayberkson.com, and there on the menu bar is a section for products. There is a drop down that says Dr. Berkson's new products. We have Receptor Detox, Hormone Balance, and Protect. This is a culmination of my being a distinguished hormone scholar at Tulane, working with the scientists who discovered receptors and say, why don't doctors figure out that just measuring hormones in your blood or your urine or saliva isn't the whole picture? You got to have good receptor functionality. That's where it's at. That's the new buzzword. These products can be taken by both men and women. They can be taken if you're on hormone therapies or not, because what they do is make the hormones that you get into you, whether they're your own or replaced, work better. You can take them before getting pregnant, during pregnancy, while breastfeeding, anyone over the age of 5 years. And it's a great way to do easy hormone detox that we'll mention throughout the talk. So there's several givens right now in today's isness. First of all, our planet is ubiquitous with endocrine disrupting compounds. We've just learned that fish flesh, we think fish is a great food. Well, it was before we had many chemicals, because now fish has the forever chemicals in it. It has microplastics in it. All of these things harm our hormones, but nowhere in med school our doctors taught how does this translate into the clinical trenches and what do we do about it. You're going to learn a little bit about how the dirty planet is attacking our hormones. Endocrine disruptors block potentially hormone function. The role of hormones is expanding, especially with COVID. We are an aging nation. By 2030, there are going to be more people over 65 years old than young people in the United States for the first time ever. Hormones are the most powerful anti-aging tool. We're going to touch on how estrogen and testosterone has been vindicated. They are safe. Estrogen protects against breast cancer. Testosterone protects against prostate cancer. But this has not yet made headline news. And we're going to talk about why we need hormone daily protection. So one of the big reasons is our dirty planet has a lot of endocrine disruptors. Well, endocrine disruptors can alter hormone signals. They can especially alter healthy brain activity because your brain is run by hormones. That's why my latest book is called Sexy Brain, because sex, steroid hormones rule your brain function. They rule your biome. They affect methylation. They affect hardwired milestones of reproduction. We have girls going into perimenopause, some of them in their 20s. We have women going into menopause earlier. Just even a few months earlier makes a big difference for your heart health, your diabetes health, your cognitive functionality as you age. It's harder to lose weight in 2022 than it was in 1982 because many endocrine disruptors are making fat stem cells nasty. We call that obesogens. So what we're learning is that the dirty planet is affecting hormones and showing up with a lot of the diseases that are showing up. We talk about it, but we don't really know what to do about it. So I decided to go ahead and try and protect us from this phenomena after having worked at Tulane. So our planet is filled with endocrine disrupting compounds. Let's talk a little bit about the increasing appreciation of what hormones do, because in med school, hormones are basically about reproductive things, sexy things, a little bit about peri and postmenopause and andropause, but it really doesn't take a look at how hormones affect the whole body. Well, we are learning that hormones protect your brain. And we are an aging nation, as I just said before. They say in 2035, it'll be the first time in the U.S. history, this comes from the CDC census, where we'll have more older adults than not. And what are all the older adults now worried about other than cancer? The other big C, cognitive decline. There's going to be 1.2 billion women that are in menopause in 30, and a third of us, most of us in the United States that live longer spend a third to a half of our life in menopause. Yet hormones have been the rabbit hole of medicine. We don't know how to caretake them. We're worried about them. We think they give us cancer, and doctors don't believe in them as though they are a religion. All this is happening while we're all worried as heck to not get Alzheimer's disease or cognitive decline. So there was a study called the Cache County study. They took a look at people that were healthy, that in their 50s, and followed them longitudinally, or they call it a prospective study. And they found that if women were on estrogen, the longer she was on it, she decreased her incidence of Alzheimer's disease 30 to 50%. If you were on the Dr. Oz show and you said there was something that could decrease your incidence of getting Alzheimer's by 30 to 50%, you'd want to run out to Walmart and get it. Well, this unfortunately was published in October of 2002, and that's the same year that the Women's Health Initiative turned the whole Titanic away from understanding what's going on with hormones. So we're going to talk about that. But hormones help rule our brain. Why do they do that? Is we store our memories in this little thing called the hippocampus, and hormones signal the hippocampus. What happens when you get older and you don't have hormones? This shrinks and your ability to hold memories shrink. You stay on hormones, you caretake hormones, it stays more volumized. According to research at McGill University, they were able to show that it could be revolumized even if it had already shrunk by going on hormones. But people say, well, if I take hormones for my brain, will it give me breast cancer in my breast tissue? There's one other study that didn't make headline news that came out a few months ago. The University of Arizona took a look at almost 400,000 women, took a look at whether they got Alzheimer's disease or not and whether they'd been on hormones or not. And it turned out that if women had been on hormone therapy for at least 6 years, they had almost an 80% less. The Cache County said 30 to 50% less if you take hormones. The University of Arizona Insurance Study said almost 80% less incidence if you're on hormones. But then how do we keep those hormones safe? That's the big deal. And none of our doctors that talk to us about keeping our wits about it are telling us that hormones make a difference, but the science is building up that it does. Yet at the same time we're discovering hormones protect your brain like that, hormones are under attack. I don't know if you're aware of a low testosterone epidemic. This was a study done out of Boston. It's now been replicated. They took a look at millions of men in the VA and they tracked them for their testosterone, and they were able to show that there is an age-independent decline happening in testosterone in young men. It's age-independent. It's not because they're getting older that the testosterone is going down. What they surmised is health or environmental effects. They don't exactly know why, but we do know that there's another study that came out showing that a large multinational study shows that the estimated prevalence of erectile dysfunction in young males is as high as 30%, and that's only what's reported. A lot of low T centers around here are saying young men are coming in bemoaning that they can't have healthy erectile functionality. They're not looking for super orgasms. Why is that? Because young men today don't have the same testosterone that grandfather had. Also, it's been shown that if you have erectile dysfunction at an earlier age, that is a harbinger of having more metabolic syndrome, more diabetes, more cognitive decline. So our hormones are under attack and nobody is really talking about this issue. It's the same with women. Menarche is when you start to menstruate. It used to be between 12 and 15 years. Now it's somewhere between 8 and 11 years. And in some countries like Puerto Rico, they're seeing breast buds in infants at 6 months old. Perimenopause used to be somewhere 10 years before menopause. Now it's happening sometimes in the 30s, sometimes in the 40s, and it's very hard to get diagnosed because everyone was taught in med school that it only happens in your late 40s. And menopause is even happening earlier. And we're seeing more hormonal issues in young women. Polycystic ovarian syndrome is an epidemic. It's like menopause in young girls. We're seeing more endometriosis, and we're seeing more kinds of anxiety in young girls. And anxiety is a flashing red light, often of hormonal imbalance, because hormones in balance help your mood regulation enormously. Now, hormones also are an anti-aging tool, and we are an aging country. I remember when I used to work at the Wiseman Family Practice Clinic here in Austin, just a few miles down the road, and Dr. Wiseman, who was running and still is running Ironman in his 70s because he's been on testosterone for years, he had been recommending hormones for his 55-year practice the whole time through. And he said if you took 100 people, we'd always have these conversations about this at the water fountain over at the Wiseman practice. He said if you took 100 people who all got the memo to exercise and eat well, but half of them were on hormones, you would be able to cherry pick them out because they would have healthier hair, healthier face. They wouldn't have the little old lady or the little old man voice. They're very powerful anti-aging tools that are available to us, and we're an aging nation and we want to caretake our brain, but we've all been made frightened about hormones. In fact, so many of my patients say, well, I asked my gynecologist and I asked my urologist if I was a candidate for hormones. Maybe my aunt had breast cancer. Maybe my father and grandfather had prostate cancer. What they're often told is, I don't believe in hormones. But hormones aren't a religion. Hormones are the most powerful, hardwired signaling molecules that we have in our body, yet they are under attack by multiple chemicals, and we live in this chemical soup that we know is a given. We have a study that came out this week showing the increased body burden of young girls entering pregnancy with a higher amount of endocrine disrupting compounds that has ever been documented. When I wrote the book Hormone Deception, Cedars-Sinai had gone in and done amniocentesis on pregnant women and found an average of 133 chemicals at that time in the amniotic fluid, and now that dosage has increased. So I've been contemplating, well, nobody's talking about it. People are frightened about it. How can I really contribute to help things out? And the reason people are so frightened of it is most doctors really have the belief, and so do women and men, that hormones are cancer causing. Women feel that estrogen causes breast cancer, so do gynecologists, so do endocrinologists, and often urologists think that testosterone drives prostate cancer. Well, Abraham Morgentaler is an associate professor at Harvard. He is on the same mission that I am, and he takes people through the whole science showing that our understanding of testosterone driving prostate cancer is flawed and only based on 3 studies, which actually won the Nobel Prize, and it's not even accurate. I think COVID has really gotten us to a good place where we question what experts say. And I think it's really time to question what experts say about hormones, because they don't just drive reproduction, they drive cognition, and COVID has shown us that they drive immunity. And so when I had Dr. Morgentaler on my podcast, I said to him, it makes no sense that Mother Nature would make the very hormones that drive humanity and reproduction and make them mainly cancer causing. That makes no sense. So why are doctors and women so afraid of hormones? Why do they feel they'll cause cancer? And Dr. Abraham Morgentaler, we lectured together in Miami a few months ago, and he put a big slide up saying nearly everything we learned about testosterone and prostate cancer is wrong. It actually protects against aggressive prostate cancer, which is what we're learning even with breast cancer in women, but your hormones have to be working and not under assault. So how did this whole nightmare all start of this big misunderstanding? It all started with the Women's Health Initiative. We're an aging country, so we want to not topple Medicare. As women get older, we don't want them spending so much money on health care that we can't maintain our health care. So the Women's Health Initiative was 40 different prestigious institutions that got together and looked at women every which way, looked at their cholesterol, looked at their bones, but also looked at their hormones, because before the Women's Health Initiative, women all over the world and in the United States took hormones for decades. No one saw problems. So they initiated a number of studies thinking they would prove that hormones protect women against heart disease and cancer so that they could keep women feminine forever. But what they discovered in that fateful analysis in 2002 was that hormones cause the very things we thought they protected against. They said hormones cause breast cancer. They said hormones cause heart disease. Because of that, Wyeth got sued successfully. We're a litigious society. Wyeth got so sued so successfully that no doctors wanted to prescribe anymore, and it became a moot point, although all over the rest of the world that has not been the case. So much so that socialized countries that track the health of their citizens, they have cancer registries, death registries, prostate cancer registries, breast cancer registries. They see that men and women on hormones tend to fare better and cost the socialized medical system less. So all the Nordic countries presently, Iceland, Norway, Greenland, Finland, also Italy, also Ireland, also the UK, they all now give hormones either for free or a very reduced cost the minute you become in your 50s. If you want to take hormones, take them because they know that they're healthier. So hormones are coming down the pike, but we got to figure out a way to keep them safe. That's one of the big things. But what didn't happen and make headline news was 19 years later, after every one of us thinks that estrogen causes breast cancer, and most of our doctors feel that way too, these very prestigious cancer institutions, this 12 cancer institutions like Fred Hutchinson and Albert Einstein, major cancer institutions, they reanalyzed the Women's Health Initiative because no one else in the world believed what we were believing, that hormones cause these cancers. And after a 19-year follow-up by these institutions, they showed if you've ever been on estrogen, it reduced your incidence of getting breast cancer by 23%. And by the way, if you'd been on estrogen and you got breast cancer, it reduced your risk of dying by 44%. Nothing has ever shown that level of protection before, and that's what hormones do, is they protect the very tissue that we and our doctors have now thought causes cancer. And by the way, it's exactly the same thing for testosterone. If a man is on testosterone and gets prostate cancer, he gets a less aggressive kind and he's less likely to die of it. But this somehow hasn't reached your doctor, who you often ask, are you a candidate for hormones? So more and more people, as the truth and fact-filled science starts to come out, are going to start using hormones. But the whole point is, now that estrogen is vindicated with the 19-year reanalysis, which didn't make headline news and most of your doctors don't know about, just like a lot of doctors don't know about VAERS with COVID, and Dr. Morgenthaler's work with testosterone, and he's done much of that research himself. Women will be taking hormones, men will be taking hormones, but we want to keep them safe, and we want to require receptor functionality. So why am I giving this talk, and why am I even passionate about this topic? I wrote one of the very first books, a breakthrough book on endocrine disruption called Hormone Deception. Based on that book, I was invited to be a distinguished scholar at an estrogen think tank at Tulane Med School called the Center for Bioenvironmental Research. And I worked with Elwood Jensen, who discovered the very first estrogen receptor, and I worked with Janaki Gustafsson. He's from Sweden, so he's discovered the ER beta, the second receptor, and he discovered it along with Ken Koresh, who I just lectured with recently. Well, they would all say that hormones are not just about sexy and reproductive things. They rule the body. They run your immune system in the gut that we all talk about. They run your gut wall health. They run your biome health. They run your hippocampus health that holds your memories. They affect your heart health, your kidney health. We would have less fatty liver because we have less hormones on board as we're aging, and those hormones help your liver prevent fatty buildup. They affect lung capacity. We learned with COVID that progesterone protects the lungs. So Mount Sinai now has an ongoing trial of giving 100 milligrams intramuscularly twice a day of progesterone to men who are intubated in the ICU, because they've been discovering that hormones do so many other things, let alone just keep you looking prettier. Because estrogen maintains your collagen, and it maintains the matrix of your body, your skin that holds you together. But in particular, estrogen and testosterone have a lot to do with your muscle mass. And the more you can maintain healthy muscle as you age and avoid the dreaded sarcopenia or loss of muscle, the healthier you can be. But what I learned from working at Tulane was it isn't about just measuring a hormone. If you go to any doctor, all you do is get your hormone levels tested. But that doesn't tell you if your receptors are functional. So a hormone, this could be estrogen, testosterone, progesterone, nestles on into a receptor. This is where the rubber meets the road. The receptor and the hormone shimmy in space and deliver the signals to the cell to tell your brain to work, for you to remember where your car is in the parking lot, for your waist to be kept thinner, for your kidneys to be filtering out and functioning better. So receptor functionality is where I learned from Elwood Jensen and Yanaki Gustafsson. This is what hormone health is about, but there's many chemicals that sit on this receptor and don't let the hormone get in. These chemicals literally squat on the receptor. So I thought, why don't I design some products that will clean off that receptor? And then when you eat well and digest well, because we are what we digest, not just what we eat, you have vitamin A, iodine, magnesium, zinc, B6. This is where all the nutrients are needed to act as cofactors for this whole complex to work. When hormones work, you think right, sleep right, have sustained great energy, you recover quickly from stressful assaults or injury or illness. They found that women who were premenopausal had less severe COVID than women that were postmenopausal, but postmenopausal women who were on hormones had the same incidence of severe COVID as young women, because hormones also signal your Treg cells, your white blood cells, your entire immune cell cascade. But it all comes down to the hormone being able to nestle on into the receptor. So when you go to your doctor and get your hormone level tested in your blood or your urine or your saliva, it doesn't tell you what receptor functionality is doing. In the laboratory in academia, they have a way of testing this. We don't have a way of testing receptor functionality except to know that when your hormones are really working well, you feel well, you have libido, you can think well, you have sustained energy, you really feel younger longer. There's no doubt about it, and it comes down to receptor functionality. So as hormones become the new buzzword in health, as it's gone on in the rest of the world who are saving their socialized medicine by giving the option of hormones for free when men and women enter menopause and andropause, it's around the corner for us. The next buzzword is receptor health, because you can give hormones to a woman that has a lot of chemicals in her body. Her perfume might have plasticizers in it, and your water in the shower has a lot of chemicals in it unless you have a filter on it. And that fish that you're eating can have the forever chemicals, nonstick cookware. They all sit right in this receptor, and even though you take hormones, they don't work. It could be your own hormones. It could be not replaced hormones. If you have a lot of chemicals squatting on receptor, you have poor receptor functionality or receptor dysfunctionality, and then you have chronic problems. You go from doctor to doctor and you don't know what's going on. So wherever there's a receptor, hormones signal. Because we think of hormones as kind of just sexy things and reproductive things or things at the end of life. You know, we don't think of them as affecting everything, but wherever you have receptors, hormones are signaling. So you have estrogen receptors in your liver, you have estrogen and testosterone receptors in your heart, you have receptors, as I said, where memories live in the brain. You have receptors in your vocal cords. Women who are taking hormone replacement, men who are taking hormone replacement, don't get the older age voice as rapidly. I mean, nothing stops you from being immortal, mortal. But you have in your gut wall, you have adhesive proteins that let your gut wall open and close. We've all heard about the dreaded leaky gut. Well, part of keeping your gut from being leaky is having hormones so that they can protect your gut wall. So wherever there are tissues that have receptors, which is pretty much your whole body, the hormone will come to that receptor and signal. So hormones are a much bigger deal than we've given them credit for. It's not taught in med school. There's like the urologists and the gynecologists and the endocrinologists. There really isn't anyone looking at hormones and how they affect all this. I treat inflammatory bowel disease quite a bit, and because I know that there's hormone receptors in the gut, even in young women, I give for a period of time hormones to help them heal, and the healing is rapid. And when I went and did a presentation at the Austin Gastroenterology Center, Austin Regional Gastroenterologists, it was their patients who had been, many of them recommended that they had their colon removed, but in a few months we were able with a post-colonoscopy to show that the disease process was gone, and part of it was giving these young girls hormones. Yes, because less and less do even our young adults have the hormone levels that they used to have. We know about COVID. If you just go to PubMed and look at COVID in the news, there's many, many articles on estrogen, progesterone, and testosterone, because we now know that estrogen rules immunity. And for those of you that want to see these slides, we're going to pass out the slides. We're going to make this available to all of you to read more on your own. But estrogen has receptors on killer cells, on Treg cells. It tamps down inflammation. One of the reasons you get more ill, or potentially more ill, as you get older is that you have less hormones on board to protect you. So one, you want to maintain your own hormones to be healthy, whether you're on replacement or not. And two, if you're taking replaced hormones, you want to figure out a way to keep them healthy. And part of that is keeping the receptor available, having the transcriptional nutrients, and also figuring out how to keep your hormones level and zen throughout the day. That's all that I had in my mind as I was designing these products. But we know for other reasons our hormones are under attack. We have gender bending. We have the threat of environmental castration. We have kids that don't want to meet and mingle. We're really, and when I was at Tulane, everybody was very worried. The big conversation was, are we going to be seeing gender bending coming down the road? So I've been contemplating since I worked at Tulane about 15, 20 years ago about putting products together that could clear off the receptor, give all the transcriptional cofactors, and have growth controllers that protected us against any kind of cancer cell line that people worry with hormones, and put them all together in a product. We also know, by the way, that fertility is under attack. So this is a great set of products if you've been battling fertility, because fertility has a lot to do with endocrine disruptors. In fact, Harvard and the Huffington Post put on a huge public forum. You could just put in, if you wanted to find out about it, Harvard and Huffington Post public forum. And it was a few years ago, and they said there's 3 threats to humanity. One is nuclear war, obviously, and the other one is global warming. And the third is endocrine disruption. Why? Because it's affecting fertility. These products would be very helpful to keep everything working better, because they keep the hormones on board. But we don't have any way set up in medicine for us to go to a gynecologist to say, how do I get my receptors working better? It's not taught in med school, this concept yet. Yet the scientists who discovered the first receptors said, this is where it's at. And if you want healthy hormones, this is what you need to do. So receptor dysfunctionality is really the result of our dirty planet. We have chemicals sitting on the receptor, and then with processed foods, we might not have sufficient nutrients also sitting. The receptor also acts kind of like a bowl, so that we don't get the hormone signals that we should. Either while a woman is pregnant, the fetus might not get the hormone signals it should, or our child might not get the hormone signals as its brain keeps developing into its 20s, and even ourselves. So now we know we have hormone receptors throughout our whole body. And they signal our brain, our organs, our skin, our heart, not just our sexual organs. To do all that job, they've got to get into that receptor. So we want receptor functionality. We don't want receptor dysfunctionality, where chemicals are sitting on here or there's a lack of nutrients. This is Yanaki, who said, I don't understand why doctors don't contemplate what's going on at the receptor level, because it's been around. So I wanted a daily protection that would protect our hormones, make our receptors available with all the cofactors. I also wanted to add things because I had designed Metagenics' first Fem line when they first opened up in 1982 for physicians. And I used a high-dose PABA and also a boron, which makes estrogen and testosterone more usable by the body. And it helps slow down the breakdown of the hormones, so you keep the hormones more zen throughout the day. big part of feeling healthy with hormones. You sleep well, you think well, your energy is well. Is hormones staying level throughout the day, and it's not that easily accomplished. But with this formula that I've put together, the first generation actually starting with Metagenics, but now being Biotics. So I've been formulating female products since the early 1980s, and this is the next generation. But I've learned a lot through many of those years. So we call anything that's sitting on here that won't let the hormone in a competitive inhibitor. So you want to also have products that get rid of the competitive inhibitors, but that work fast, right? And that's part of the problem. If you take a multi, you don't really, what do you feel? You don't feel much, but like I wanted to do something that worked fast. So right before the products were available, I was lecturing in Virginia saying all the different ingredients that I was going to put in the products. And one of these women that was a practitioner in the audience had for many, many years been suffering 9 years with severe headaches every time she had her period, so much so that she'd ended up in the hospital. She'd seen many, many physicians. 40 days out of each year, she had extreme pain and vomiting. So she had her period last week after adding in the nutrients I talked about, which are now in these 2 products. She was on them for 3 weeks, and her next period had no pain. And since then, she's had no pain. So what I've discovered in working with these products is they work very, very fast. This one product clears off the receptors, and it's got very specific ingredients, botanicals, and nutrients that detoxify what might be competitively inhibiting, what might be squatting on that receptor, so your own hormones or hormones that you have replaced can't get in. And Hormone Balance and Protect is a way to keep your hormones safe. If people go, I'm worried about cancer, this is a complete product to protect against growth out of control. Cancer is growth out of control. That's why it's called Hormone Balance and Protect. It also has vitamin A. Vitamin A is on all binding domains of all hormones. And the 2 products together have the right amount of iodine and the right amount of vitamin A, so that at the receptor level, hormones can deliver their signal. But even though they deliver signals, there's not growth out of control. So many of the botanicals in here act against multiple cancer cell lines, prostate cancer, breast cancer, ovarian cancer, as well as bone protection and liver protection. But I myself have had breast cancer 26 years ago. I've been on hormone replacement for almost that time. I've had breast cancer now, I think 30 years ago, and I've been on hormone replacement 26 years. So I care very much of not getting cancer. So I designed this formula based on my years of research on how to protect myself, keeping my remission, my mission. And here I went into the clinic. I work at Naples Center for Functional Medicine, Dr. Perlmutter's old clinic. I worked there 1 week a month. And when I went in the last time, Tia works at the front desk. She's a young woman in her mid-30s. And she said, I got to tell you, my life has changed taking these products. So I asked her to do a video. She said the first day of taking receptor detox, she got euphoric, and she didn't realize that her hormones had been unbalanced all of her life. And then she said, for the first time in my life, I've had a libido. I've never had it. So she put together this little video.
I've been taking the Hormone Balance and Protect.
Oops.
I've been taking the Hormone Balance and Protect and Receptor Detox for about 2.5 weeks now, and I've noticed in that time a euphoric feeling in the beginning when the hormones were finally reaching the receptors that I wasn't used to, and now I find that I am more balanced all day. I'm not as tired anymore. It's increased a sex drive that was almost non-existent. And I'm very happy with this product, and I hope it helps others too.
So that was pretty incredible. The nurse practitioner, we also have a video from her. Unbeknownst to me, she came up to me and said, I've been on bioidentical hormones for a few months, and my libido, I still had fatigue and libido. Nothing had changed. And I've been on your products for 2 weeks now, and my husband wants to buy you dinner. So she also made a video. And that's because we don't realize the difference in our health when our hormones can't reach those receptors and can't signal, or our hormones aren't balanced throughout the day. So just as though we've now gotten used to the idea of vitamin C and B vitamins and a multi to be taken daily, because of our dirty planet, you stand underneath your shower, the water treatment plants are not designed to remove the hormones from birth control pills or from menopause hormone therapies. There's many organochlorines. There's so much in your shower water. It's extraordinary. You want the protection of your hormone receptors so you can enjoy your shower. You should put a filter on there. But nonetheless, it's hard to imagine from morning till night how many chemicals that we're exposed to that now their target are our receptors and our hormones, and yet there's nowhere to go, and there's no other products that ever dealt with this. It was just the fickle finger of fate that I wrote Hormone Deception, and based on that I was invited to be a scholar at the Center for Bioenvironmental Research at Tulane, and I realized, and I'd already designed Metagenics' first femline, so it was in my brain about designing products. So this is really a fickle finger of fate, I believe. So these products gently detox your receptors so your hormones can work. So these two women, they both said, I had no idea Tia, she doesn't talk to me about her health, had no sex drive her whole life. In 2 weeks, it turned her sex drive back on. Now, I have had one patient I'm working with that hasn't had that response. So, there isn't something that works for every single person, and whoever would say that, you'd want to run in the opposite direction. But these products also give you growth control. So when you now go on hormone replacement, that's around the corner to do it, because all the other rest of these countries that are socialized medicine observers, they're showing us, leading the way, that hormones replacement takes the burden off of the medical system of the country, and it compresses your morbidities to a smaller, further time in your life, so you have better cognition and less cancer, or less death from cancer if you are diagnosed from breast and prostate cancer. But most doctors haven't heard those vindication reanalyses at this point. But when you do decide, if you do decide to go on hormone replacement, you'll want to have peace of mind of keeping growth control so that you won't be at risk of cancer, and that you can move through this toxic planet with more peace of mind, with more Zen hormone health. So I designed the first female product for doctors, the Metagenics Femline, and I've had breast cancer, so I care a lot about all these things. I wanted a product to do all the things that I've just told you. These products should also help reduce excessive thicker blood, which is an independent risk factor. So it's kind of like, soon clinicians are going to want to prescribe hormones again. They're doing it around the world. It's the litigious atmosphere in the United States that's unfortunately made men and women not get availability to hormones like we should and could and want to. But we're going to want to figure out how to keep these hormones safe. And that's why I came up with these new products. Now, they don't just work for sex steroid receptors. We have a lot more thyroid, autoimmune disease, thyroid resistance, insulin resistance. You can have resistance to any hormone. You can have progesterone resistance. We can have adrenal issues. We have an increasing incidence of parathyroid issues. These products will help for all receptors, that even help with the production of pancreatic enzymes from your pancreas. So this is just a summary of some of the things that that are in here, and I'm going to run through them a little bit, not in depth, but parsley is a hormone normalizer. It is huge, and it causes apoptosis or death of many cancer cell lines. So when I had breast cancer and I was first investigating how to keep my remission and make it my mission to do so, the one thing I did was consume a bottle of organic parsley a month, because dried organic parsley has the highest amount of the magical flavonoid that protects against cancer. So I had to put high-grade, wonderful amount of organic parsley in Hormone Balance and Protect. It's apigenin. It downregulates all inflammatory molecules and it protects against cancer. It protects the lining of blood vessels. It protects against growth out of control. So that includes polyps and colon cancer. It even helps, it's been shown even in mice that were altered by surgery to gain weight. When they were given apigenin, they gained much less weight. So there's several botanicals in these products, since I know weight is such a problem for so many people, and chemicals are making our fat stem cells not work well. I just turned in an article for the Townsend letter on what's going on with our fat cells in our dirty planet today. But apigenin really will help fight that isness that makes all of us saying it's so much harder. I exercise and all I have to do is look at food and I gain weight. So apigenin is a botanical that helps with that. It helps with growth out of control. We know Elwood Jensen found the first receptor, so it was labeled alpha, and Yanaki found the second, and it's the balance of both receptors and tissues that keeps us well. And that's how I design these products, to keep the balance of receptors in tissues in a healthier way. Apigenin also protects the ovaries. One research showed that it deaccelerated ovarian cancer. These are all botanicals that put the brake on excessive growth. Cancer is growth out of control. Everyone worries about hormones causing cancer, so I myself, having had cancer, so I wanted to accomplish that, and that's what I did with these products. There's also a lot of lignans, which we hear about the benefits of flax seeds. Those are another high source of lignans, but parsley is also very high in lignans. There's milk thistle. We think of milk thistle as mainly helping the liver, but it also keeps your receptors, the ratio, normal, and it also controls growth out of control. It also reduces inflammation and reduces risk of autoimmune disease. There's studies where they give rheumatoid arthritis or other autoimmune patients milk thistle, and they have tremendous benefit and reduce their flares. So I have milk thistle in this product for a number of reasons. It also, shockingly, is bone building along with your minerals that we know are bone building. We don't often think of milk thistle as bone building, but it is. One of the big things to prevent any kind of breast or prostate cancer is to keep the architecture of those tissues healthy and normal. Iodine controls the architecture of hormone tissues, and it also helps detox lymph and move hormones through these tissues. So both products are designed to be taken together so that together you get 3 milligrams of iodine a day, which I felt was a really good amount for a daily dose of iodine. Or let's say you take the products Monday through Friday. Maybe you're not ill, so you're not going to take them every single day. But we are exposed to these chemicals 24/7. So I designed these products to be used together, and together you get 3 milligrams of iodine that helps protect and maintain a healthy architecture of your main sexual glands. In a man, the prostate, and a woman, her breast and her ovaries. They're both designed to be taken together, and usually I start with receptor detox. I'll start with 1 the first day, and then the second day go to 2, the third day go to 3, and the next day go to 4. So a detox is 4 a day, 2 twice a day. Just a regular amount is 1 twice a day. But when you're detoxing, you're doubling the dose, but it's so powerful and strong, you taper up into it. So you do 1 the first day, the next day you do 2, although Tia and Rona, the nurse practitioner, they just started taking both of them 2 twice a day. And they didn't get sick or anything like that. But I have people taper up to it just because they clean out chemicals from you so much. I don't want them to clean it out too rapidly. But the regular dose is 1 twice a day of receptor detox. The regular dose of hormone balance to get all those botanicals in is 2 twice a day. But when you're doing a detox, like if you want to do, let's say you want to initiate hormone replacement. So you want to make sure you clear off your receptors. You'd want to build up to 2 receptor detox twice a day. That's 4 a day. So you're doubling the dose. And you want to do it for about a week, then initiate your hormone replacement. If you're already on hormone replacement, you could just go ahead and continue it, but still do a detox. You could do the same thing every few weekends. You could do 2 twice a day. That's a detox level where you're really getting a deeper detox. If you want to do where you do juices and eat really more specifically and healthfully, you can also do a detox several times a year. Dr. Jonathan Wright, he's credited with being the father of bioidentical hormones because he wrote the first bioidentical hormone script in the United States. He often will detox his male patients before, he mainly works with men, before giving them testosterone, because he's aware that the low testosterone epidemic is because receptors are so filled with chemicals. So he felt like he shouldn't just give them hormones, he should first clear off their receptors. So he actually, on his own, had been contemplating this and doing this with a number of his patients when he found that some men that didn't respond to hormone replacement, once he detoxed them, then they did respond. But remember, these are designed ideally to be taken together. Together you get the right amount of the minerals, you get the right amount of iodine, and Hormone Balance has very specific boron and PABA in it, and a very specific dosage that I found since formulating Metagenics products and using that on thousands of women, the amount that would keep hormones more level throughout the day. Iodine is a detoxifier. This is what we put on the summary sheet when you get your slides. This is what Biotics put together on their summary sheet. There's quite a bit of cilantro in the receptor detox that promotes detoxification. So cilantro was another thing that I've been taking since I was diagnosed and wanted to make my remission my mission. Every month I'd go through a bottle of dried organic parsley, and every month I'd go through a bottle of dried organic cilantro. Now I can take the products, but I was reading up on a lot of the literature. How do I prevent myself from getting cancer back? And of course, many of you know my story. I had multiple cancers early on. Dandelion is quite an extraordinary product. I used to gather dandelion in Maine and Vermont and saute them on Sunday mornings with eggs, as I've always loved dandelions, but dandelion root and greens really help reduce the incidence of cancers, breast, ovary, and even prostate. It's a multitasking herb because it also sensitizes your insulin receptor. So along with the milk thistle, this product should be helpful in shedding a few extra pounds that you couldn't shed before. We know that heavy metals are in fish and in soil. Dartmouth has a very high incidence of breast cancer because it has so much cadmium in its soil. So cadmium is highly linked to breast and prostate cancer, and cilantro and dandelion root detox cadmium off of receptors because cadmium is a metalloestrogen endocrine disruptor, but the formulas in these products, if you're exposed to cadmium, is removed. Now you might say, well, I'm not exposed to cadmium. I live clean. If you live in an apartment building where other people in the building smoke, they don't even have to be a contiguous apartment. California laws, one of them having to be my patient who was married to a judge, discovered that smoke travels through walls easily, and they tested urine of many people living in apartment buildings and found cadmium and different metals in the urine of young children who were getting it from smoke coming from cigarette smoke from apartments many apartments away that weren't even right next door to the children whose urine they tested. So you'd be shocked at the exposures that we get on a daily basis that assault our hormones. And we have receptors for hormones from the north to the south. And when those hormones can't signal to your tissues to do what your tissues should do, you don't feel well. And you don't know why you don't feel well. When you go talk to doctors, there's no one to really discuss this. By the way, chocolate is very high in cadmium. The chocolate industry is scrambling to try and figure out ways to reduce cadmium burden. Chlorella also removes cadmium and other metalloendocrine disruptors, so we have chlorella in the product. And again, I wanted to keep the hormones very level throughout the day. That was one of the big things why I called it hormone balance, and the protect is the botanicals that control growth. So it all is based on the dose of PABA. So this is a summary again, which I don't need to belabor here. PABA is the great hormone potentiator. When cortisone first came out, it was considered a miracle drug, but it cost a lot of money. And someone figured out if they gave it with PABA, it would slow the breakdown of cortisone down so that you could get the benefit from cortisone, but not to need it to take near as much. Well, then they started to test it with thyroid and with other hormones. And so I started working with the dosages and the science of those studies to give the amount that these studies showed would slow down hormone breakdown and keep it healthy and level. Vitamin A, it's not a trendy hormone. It doesn't get much respect anymore. But if you don't have vitamin A on board, none of your hormones will work. The retinoic acid is a cofactor in every single hormone receptor in the entire body, from insulin to adrenal hormone to thyroid hormone. You need enough vitamin A. And so we have just the right amount of vitamin A in the Duo products. So we detoxify carcinogens, we keep estrogen safe, we promote balance between all the receptors, we reduce inflammation, and the whole idea is to take it on a daily basis, or if you want to do a detox, you can double the dose. Doubling the dose of receptor detox would be 4 a day. If you want to do a detox, you could eat all organic, eat 5 colorful veggies a day, do a coffee enema, and you got a great detox, an easy detox. I try to eat 10 vegetables every day. Everyone who knows me knows I eat a lot of color. I feel that that has a lot to do with keeping you healthy. Those colors each have fabulous actions. So there's lots of colorful botanicals in these products too, if you don't get around to eating them yourself. Everyone always says, well, you know, you look pretty good for someone who's going to be 74. So what do? And one of the things I like to do is take a small dose of niacin every day because it brings blood flow to the skin. So I put the amount of niacin that I take in both products so that you get the same benefit for your skin. One woman had a little bit of flushing from it because she wasn't used to it, but it's a very low dose, but it's the dose that I've been using for years to try and keep my skin, which is looking great and feeling great, all come down to circulation. And you need to have niacinamide to make all of your hormones. This is a hormone pathway from cholesterol to your hormones. You need niacinamide. It's the bomb to make all this work. So I've got a little bit of niacinamide in the product. So all the building nutritional factors to keep your hormones doing everything they should do are in them. And it slows the breakdown of other hormones. So for example, if you're taking adrenal support or thyroid support and you took it with these products, you'd get more bang from your buck from other support. So this is just showing an example of using this product to help with other types of supplements. If you took a multiglandular for really ill people with POTS or dysautonomia, chronic Lyme, you want to get this product into them, you could use my products to slow the breakdown down and to help the body use it better. The same way with any other kind of hormone glandular product. The same with bone support. This given along with any bone support that you're taking should make it work better. But one of the biggest things is hormone replacement is about to burst wide open. The rest of the world is seeing this. So hormone replacement is coming down the road. If you're not feeling it and you're on it, you might consider taking it. And if you want to have peace of mind, this would give you peace of mind about it. So here's that testimonial that I promised you from Rona.
Hi, I'm Rona. I'm a nurse practitioner and I work with Dr. Berkson. I am on bioidentical hormone therapy for fatigue and low libido. I decided to add these 2 products. After 2 weeks, let's just say, I made my husband happy to the extent that he wants to meet Dr. Berkson and buy her dinner.
I went into the clinic the other
Hi,
day
I'm
and
Rona.
Tia said the same thing. They both said it happened after 2 weeks. And that's what happened when I lectured in Virginia. That woman went out and got all the individual constituents because the products weren't available yet. And her 9 years severe saga of horrific premenstrual issues stopped in 3 weeks. These products work fast, or at least so far. We're going to be doing a study on them. But in essence, the beginning of the products were years ago, but now this is a whole nother layer after having been a distinguished hormone scholar at Tulane. These are all the different types of conditions that might be useful, and you can go over this slide on your own. That might be helpful, but the biggest thing is it gives you hormone peace of mind. If you want to go to my e-store, you can go to my website, drlindsayberkson.com, and in the menu bar, there is it says products, and the drop down says Dr. Berkson's products, something like that. Or this is the direct link to my e-store. You can buy the products there if you're interested in getting a start, because there really isn't any other products to help our hormones deal with living in today's ubiquitously dirty planet. I also have a summary of the whole estrogen vindication story in an ebook available at my website, drlindsayberkson.com. And I also have a membership where I get together with members and we talk about many things like this. And we have a group for practitioners. There's quite a number of physicians and gynecologists and pharmacists in that group. I think that level has about 85 now, and we actually have a number of doctors from Israel, I think, that are, one of them is opening up one of the first hormone clinics in Israel. So we're really helping and reaching a lot of people. But what the scientists I worked with at Tulane would always say in frustration is, why isn't this reflected in clinical practice? And why do they just measure levels when levels of a hormone don't mean anything? It's only if they can get in and signal. And that depends on the receptor. Receptor functionality is where it's at, but the dirty planet is giving us receptor dysfunctionality. So now we got to get it in our mind, if we really don't want to get ill, we want to keep all of the things that hormones do, from our cognition to our liver to our libido, working, we need to consider now caretaking our receptors and keeping our hormones level and keeping them balanced and controlled. So I'm going to take a look at the chat room. Honestly, this is so exciting because my life has been ruined by hormones and saved by hormones. My mother was given the most powerful endocrine disrupting chemical in the womb when she was pregnant with me, which had me have many cancers when I was young, and no one could get me well, and started me on a saga of how to get myself well. But I didn't know when I wrote Hormone Deception that any of that was true. So I know I'm on my mission. I know this is what it's about. And I know that we need to caretake our hormones, and we need to be open to replacement as we age because they're so powerful, but we still all want to be safe. So I'm excited to be able to introduce this new line. And let me see what the questions are. A question about bioidentical.
Yes,
yeah.
may I just speak, Dr. Berg?
Yeah, sure.
Okay, thank you. Yeah, I've been searching to have bioidentical, but it has been kind of difficult to understand what is the right way. One doctor says, oh, there's no need for testing. We'll just start.
Okay, well, that's a whole nother question, but understand this. If you were to go to 5 cardiologists, if you had an issue with your heart and you went to 5 cardiologists, you'd get 5 different answers, most likely.
Okay.
One of my friends just had a back issue and went to 3 different back surgeons, and they all recommended totally different surgeries. So that is why medicine is the art and the science. And there are a lot of people who say you should only test with saliva, you should only do this, you should only, I don't think there's very many onlys. I think the bigger your tool bag so that you can address the patient, because some patients do well with one form, another patient does well with another form, and we've also learned that in one's own life, the way you take in hormones might need to shift over your years. So the doctor that knows the most and isn't biased and doesn't think that there's only one way, in my mind, and that's a hard person to find. That means somebody, the more you read and learn, the more humble you are, and you realize there isn't only one way. And that's what you want to do, is find someone who's not so arrogant that there is only one way. But the whole question of bioidentical hormones does become extremely confusing for patients. That is a whole nother discussion. Sorry, we just don't have the time for that. But the bottom line is, any way you take your hormones in, whether they're your own or they're replaced, whether they're oral, whether they're vaginal, whether they're topical, whether they're micronized, what size of micronization they are, you want to keep your hormones safe. If your receptors aren't functional and you don't have the right transcriptional factors and you aren't on botanical control factors as you age, because we get growth out of control as we age, and we're all aging, you don't have the same health. But it is exasperating. It's exasperating for everybody. I'm with you. I'm with you. I'm with you. I am a patient as well as a doctor. And just know that you want to find those people who you think are agile thinkers and aren't arrogant, and that are willing to listen to you and what works for you. So that's my answer for is what I could go into for at the moment. And I hope that you found that somewhat helpful.
Thank you
And
so much.
okay, thank you. Is that Shida? Shida?
Shada,
Shida, beautiful name. Beautiful name.
thank
Any
you.
lab test for androgen receptor? There's no test right now for receptor testing. So it's how you feel when you're you just heard two people. One was already on hormones. The other one's only in her 30s. And they went on the products and suddenly their hormones started working well. They felt balanced. Tia said she had euphoria a little bit in the first few days. She got a libido back. It's how you occupy your body suit. And true wellness is not hypochondriacal. It's not intermittent. It's most of the time you feel strong and well and motivated, and your brain is turned on so you can use it and enjoy it. That is a healthy person. But you know, you go into your doctors and they don't talk to you in that way. I go in now and they ask me these Medicare questions. Are you fearful in your home? Are you afraid of falling? I just can't even. My internist, God bless her, has never run an estrogen level on anyone in 35 years of practice. You have to have someone that has hospital privileges wherever you live in case you need to go into a hospital. But they practice such a different medicine. But hormone health has so much to do with your brain, your sleep. If your hormones are working well, you're not searching for words a lot. You're speaking at the speed you spoke when you were younger. There's a lubrication to your voice. There's a upward lilt. Your vocal cords are working. You don't sound old. That is, you want hormone health slows aging down. It doesn't prevent it, but it slows it down. You can tell when someone's hormones are working well. There aren't a lot of people, God bless them, I'm hoping we get more and more, that are going to be 74 and giving a talk like this. I don't know why that is, but ever since the 19-year reanalysis, I've been feeling much safer to go in higher and more balanced dosages of hormones, and I've noticed a very big difference.
One of the questions asked if you recommended taking binders while taking these products at a detox level.
No, you don't need to take binders. Binders would be if you wanted to add them. Sometimes you could, but you don't need to add anything to this. That they stand on their own. But if you wanted to add them, you could. So sex hormone binding globulin is a protein that testosterone and estrogen squat on, and it carries them through the bloodstream. And when they get too high, which they do with aging and they do with thyroid disease and many diseases, there's a long list of reasons why sex hormone binding globulin gets high. And when it gets high, it's difficult because whatever hormone you have isn't available for the receptor. So very elevated sex hormone binding globulin is a problem, and it's not easy to bring down. The combination of hormone balance and protect is supposed to help normalize sex hormone binding globulin. This might take a few months up to 6 months for that to occur if the product's going to help. But the problem with sex hormone binding globulin, as you just learned, is it can be elevated. You don't want it elevated. It can be elevated when you're older, when you're you have diseases, any underlying diseases, you have anything that's not right, you're on certain medications, it elevates. So sometimes it's so multifactorial, just taking a nutraceutical formula isn't going to lower it. But yes, this product was designed in most people, and that's a great question, to help normalize an elevated sex hormone binding globulin. Wendy Schmidt just got out of work. I've been waiting for these supplements. Can't wait to get my hands on these. Paula Parker, how long should a patient be on these products before initiating BHRT? You can be on bioidentical hormone replacement and start it. But if you haven't done it yet, it's a great way to do a detox for a week. So all you do is the receptor detox. Then you add in hormone balance and protect, and then you add in the hormones. So just a week. You can even do it if someone doesn't want to do a week. You could do 5 days, depending on their age and their health history. If you have a woman who's 300 and some pounds, she's going to be holding a lot more chemicals, right? Because fat cells store chemicals. So if you have a much larger patient and they're a little bit older, they're initiating hormones in their early 60s, not in their 50s, they're probably going to have sequestered a lot more chemicals. So you have the option of, with someone larger, going up to 5 or 6 receptor detox a day and for a little bit longer period of time. But the basic detox dose is 4 a day, 2 twice a day. And usually before hormones, you do it for 5 days to a week, and then you go on the hormones. If you're already on hormones, you can do it while you're on the hormones. You don't have to stop them. And remember, it detoxes your receptors, so that means it makes your own hormones work better. Tia's not on hormone replacement. She's just in her 30s. And look at the difference. I had no idea that Tia had never had a sex libido in her life. And after 2 weeks on these products, she got an increase in libido. And now Rona's husband wants to buy me dinner. I haven't met him yet, but I thought that was so adorable. And that all was unsolicited. I walked into the clinic in Florida a few weeks ago, and Tia pulled on my outfit, and then Rona did, and it was just one after the other. It was really pretty cool because we had just gotten the products in the clinic. So now everyone's going on them, and we're all excited to see what happens. Let's see, I've been postmenopausal for 3 years now. I will be 47 in September. So if you're postmenopausal for 3 years, so if you have menopause at 45 years or less, the Mayo Clinic studies clearly show that your heart is under risk. You've got to go on hormones or you're at risk of a fatal MI, a myocardial infarction. But I feel I need something, right? Because you don't have enough hormones. So you have to be, so the Mayo Clinic did a huge study tracking what is the dangerous age if you go into menopause too early, because hormones protect your heart. We just learned they protect so many things. And if you don't go on hormones, you're at risk of your heart going into a heart attack. So most likely, someone should be working with you for that, because you had it 3 years ago, so you were already 44 when you had it. You should have been on estrogen right out of the chute. Anyway, that's just a comment, but there you go. The flaxseed recipes, can I do if anyone wants to do a consult with me, you can go to my website and there is a consult. Maybe Sarah can put the link for that, and then you can just sign up, make the payment. The payment covers about 5 hours of my time. By the time I do a 2-hour intake with you and work on your notes and go over all your labs and work out the strategies and so forth, it doesn't include labs or anything like that, but it's about 4 to 5 hours of my time. And if you're interested in that, you can go and read up on the consult section, and I think Sarah's going to put that in there. Is there more than one way to do anything? That's great, Paula. The whole idea is to learn more and more ways to do more and more things. And that is truly the person who understands that there is no one way to do anything. But yet the experts often say their way is the only way to do something. Boy, do I not like those kind of people. I also don't like anti-aging experts who are in their early 20s that are telling us if we eat the way they eat, we won't get older. So now I've earned the right to be an anti-aging specialist because I'm almost in my mid-70s. Okay. I have been on bioidentical creams for about 10 months. What is the exact way I was? Just the same way. Just do 1 week of receptor detox and then just add in the hormone balance and protect. So the total dose of both is 1 twice a day with receptor detox and 2 twice a day with hormone balance and protect. But when you initiate them for the very first time, you just taper up. So you do with hormone balance and protect the first day, you do 1 twice a day. The second day, you do 2 twice a day. I just taper up a little bit just because they're strong, just to let your body acclimate. But Tia and Rona didn't know that, and they just started on them full dose. But you can just start on them right now. You could do receptor detox for a week, and I would do 2 twice a day to clean off your receptors, and then add hormone balance and protect, and I'd go down to 1 twice a day receptor detox normal dose. So the normal dose of receptor detox is 1 twice a day. Hormone balance and protect is 2 twice a day. We couldn't make it smaller because I have so many things in there. Okay, see you in Charlotte in a couple of days. Yeah, it's exciting. We're going to be in Charlotte, and I'm going to see Karen. I'm going to see my goddaughter. I'm going to see Sarah. We're going to see the whole gang that helps us do all these things for you guys. Are your products? It's not similar to DIM. DIM is the diindol methane is a product of the Brassica family, and it helps the body metabolize estrogen. And it's a metabolizer. It's a food polyphenolic metabolizer. These are totally different than that, but these also will prevent tremendously hormones from being poorly metabolized and to keep them safer. DIM is only one aspect of the Brassica family that helps take estrogen through all of its conjugation phases in the intestine. So DIM is nice. It's a very limited, very small. If you eat a lot of Brassica family foods, you probably get plenty of DIM as long as you chew them well. But these products are much more sophisticated and much more involved. So I'm a little bit sad that after this whole entire talk, Sharon, you asked that question. So maybe I didn't do my good job of explaining it. So I apologize for that. But DIM is great, but these products will be even better than DIM has been available for a long, long time, but it doesn't address all the things that these new products address, in my opinion. Up with Dr. Shade's Black Box 2, and I'm wondering if you think it would be okay to start with both of your Biotics products at the detoxification dose or at the normal dose. You can do them either way you want, but if you want a detox, just build up to receptor detox in 2 days at 2 twice a day. So the detox dose of receptor detox is 4 a day. So the first day do 2, the second day do 4. Then you're on them for 5 days, for a week, whatever you want to be. And then you build up. Hormone balance and protect is not the detox product. The only product you need when you're detoxing is a higher dose receptor detox. But when you add receptor detox throughout the year, if you want to do a 2-day detox or a week detox, then you can just add it on to the hormone balance and protect that you're already taking. So you can detox with these at any time. That's totally fine. So the receptor detox is what detoxes. Then when you're done detoxing, you add in hormone balance and protect, and those are your daily protection. If you are already on both products and you just want to do a detox, you could just double, or if you're larger, triple, or if you're really large. Let's say you have a patient that's 400 or 500 pounds. They're going to have a lot of chemicals in them. But you'd still want to taper up because as you use these products, you move chemicals through you. I think from my earlier research, one of your products contains calcium D-glucarate. But if I take calcium D-glucarate currently, I gain weight instantly because it lowers my low estrogen even more. No, this is in a dose that won't do that at all. This doesn't lower estrogen at all. Does not do that. But I don't think there should be any problem with that because most people give calcium D-glucarate like 500 to 1,000 milligrams. I just have like 100 milligrams, a very small amount, just to help with the detoxification to get those chemicals off the receptor site, it's a really good component to do it. But that dosage shouldn't be, this isn't lowering estrogen. So what would I have to wait till I'm on? No, you don't have to be on bioidentical hormones to do the products. Anyone can be on the products. I began this talk saying you could be pregnant, you could be breastfeeding, you could be 5 years old. Remember that slide? You don't have to be on bioidentical hormones to be on this product. It's to keep hormones safe. How high is too high? Well, that really depends a lot. Usually you look at the reference range of the lab, and you don't want it to be in the upper 10 points of the reference range of the lab. Why? Because it binds up free testosterone and free estradiol. It binds them up, and then they can't signal. So that I would go 10 points below the reference range of the lab. Do you take these two products? Yes, I do. Take without food. Take these products with food. Definitely with food. You can take with any other supplements. There's no contraindications at all. I was diagnosed with hormone positive HER2/neu. So was I. I had all the same breast cancer as you. And I'm getting radiation, Herceptin, Virjuva, antibody treatment and prescription. I can't make a comment on your breast cancer treatment now. I'm so sorry. I hope that you do really well with whatever you decide to do. We usually recommend regular care along with adjunctive care, but every case is very, very different, but I can't really make a comment on your treatment, but I wish you all the best. Most cases of breast cancer are successfully treated these days. Most women do really, really well. The first 2 years is the big deal because you don't want a recurrence in the first 5 years. The next 3 years, which makes up the first 5 years after diagnosis, are the really important times you want to make your remission your mission. So Hormone Balance and Protect would be such a great product for you. Remember, I designed these keeping in mind that I had multiple cancers and I didn't want to have cancer back. Have you or are you considering an update? Yes, I've written an update to it, but I haven't published it yet. But I actually have. Great question. But they didn't want it to be an update. They said that wasn't a good idea, so I'm coming out with it as a different book, but I have done that. But thanks, Carl. I love you. Sending you love. I'm starting on my longevity plan this year doing HIIT. What's HIIT? I don't know what that is.
High intensity interval training.
Oh, good for you. I think pushing yourself is definitely where it's at with exercise, in a sane manner. Yes, this is recommended for men, both genders. Yes, definitely. What if you already take a good amount of supplements? Well, you won't need to take a lot. If you look at your supplements, these have so many things in them that you don't need zinc. You don't need. You're not going to need your vitamin A. You're not going to need your iodine. By the way, I also have grapeseed extract in here, which is tamps down the aromatase enzyme. These are all really years have gone into these formulas. It looks like one person said to me, well, this looks like everything else that's in all my other things, but that's not really the case. But you really cut out the need for a lot of different supplements when you take this. So that's one of the nice things. You might find that you only need to take, if you're on a multi, do that like twice a week. You'll be able to cut down on a lot of your other supplements. So these are my go-to, what I center my supplements around now. But of course, I was doing all these different separate things for years because I had breast cancer so long ago. What if you already... Thank you for this. It's fabulous. Do we take the 2 supplements? Okay, so just like you would take vitamin C or resveratrol or vitamin D, we want to take these the rest of our lives. We might not take them every single day of the week. I'm having a live talk this Thursday, and we're going to talk a lot about how do you know which supplements are important for you? How do you take them? How long do you take them? Can you take supplement holidays? What's involved? Because it's hard to know, how do you... If you walk into a health food store, if everything is good for you, you'd be spending your whole day just swallowing supplements. So we're going to be talking about that in this live meeting this noon on Thursday. supplements and rotating them and figuring out which supplement is good, and some ways you can read a label and find out that the supplement's kind of cheap and not good. So I'm going to go over a number of things like that. But these would be two products, because we live in a dirty world and because hormones run all of our biologic real estate. You're going to want to be on these products on a daily basis, or at least Monday through Friday. If you're just initiating hormones and you're on them for the first year, you might want to do them every single day to really get your receptors clean and get your hormones working well. And then as you really get your dosages and everything worked out, take them Monday through Friday. Because I've had breast cancer and other cancers, I take them every day because I understand what's in them and how they're so protective. So, really interested in the question around autoimmune thyroid. I give iodine to all my autoimmune patients. That there's a big controversy. Alan Gaby and David Brownstein almost duked it out. They called me up and had me referee a conversation between them on iodine. But Alan is not in practice and hasn't been in practice for years. So a lot of his thinking, which is, of course, being frightened of iodine if you have autoimmune disease, is theoretical. It's not clinical. Whereas Dr. Brownstein has been using iodine in practice for a very long time. So I am not of the school where you have to avoid iodine if you have Hashimoto's thyroiditis. Iodine helps all of your hormones work better. It maintains the normal architecture of your breast, ovary, and prostate. It's what you want on board to avoid prostate cancer. It's what you want on board to avoid cancer, breast cancer, or a recurrence of breast cancer, or a recurrence of ovarian cancer. You want iodine on board as you age to keep all of those organs in a much better condition and to move them through your lymph system. So after many years, I've decided that 3 milligrams is about the daily dose that we can all take that's pretty healthy. Dr. Brownstein recommends a much higher dose than that. He's a little bit of a cowboy with dosages. But yes, I do recommend doing iodine on a daily basis. Nothing gets your hormones working as well as iodine. It's an important transcriptional cofactor in the binding domain for all hormones. When I was at Tulane, we talked about iodine quite a bit. The last few hormone conferences sounded like naturopathic conferences because nutrients have such a role in allowing hormones to do what they're supposed to do. And iodine is a big one. If I naturally favor the 2 series but seem to have trouble with some phase 2 detox, including a SNP, will these help me? They should, theoretically, so why don't you take them and write to me and let me know what it does for you. But so part of the health of your hormones is metabolizing through your body. So your body makes a hormone, or you're prescribed it, you use it, and then you get rid of it. And when you get rid of it, it goes through different phases of clearing it out of your body. And there is a phase that happens in your liver where your estrogens are made into catechoestrogens, and people look at the ratio of those. So these products should help keep the metabolism of hormones safer, but it's more about the receptor than the metabolism of the hormones. That's the difference between the DIM and these products. These products are to protect you from the planet that is so filled, ubiquitous with endocrine disrupting chemicals that are affecting us in so many ways. We want to keep our receptors functional and also keep our hormones level and work well. It isn't so much about metabolizing them. If I have mercury, can I use chlorella? Because I've heard, no, you can definitely use it. My beautiful friend, you are looking fabulous. Oh, Lisa's on here. So excited for your new Lisa. Lisa.
Hello.
Lisa, I love you.
I love you. I'm so excited for you.
So glad you let me know you were here. Be well,
Love
honey.
you.
Let's talk soon.
Yep.
How long do you recommend we stay? As long as you're on this planet and the planet continues to be dirty. So they're to be taken on an ongoing basis. If you don't like that, and that doesn't sit well with your supplement regime, you might just decide to do them a month on, a month off, a month on I take them every day because I'm sitting in this room and the floor is outgassing. Even though I have no VOC paint on the walls, you got to know that the materials underneath the walls have some things. My Even though I don't use Roundup, there's people in my neighborhood that do, and it gets aerosolized in the air, and things get in on the bottom of your shoes. We live in a dirty planet, so that's what these are about. And unless we graduate to a clean, the Bubble Boy planet of the Seinfeld episode, maybe then that Bubble Boy wouldn't need to take these, but he still wasn't such a happy camper. How do you know that you have enough detox and need to stop? You just detox on a regular basis to keep your receptors clear. When your receptors and hormones are working well, you should feel well. But it might take you a while and a number of detoxes to get there. But usually the detox is just for a week. And then you add the hormone balance and protect, and you're on both, and that's your daily regime. And if you want to detox some more, you want to give a little extra cleaning out of your receptors, you could double the dose of receptor detox over a weekend or double the dose for 5 days. You can do it in any creative way that you want. But what would be really great is if you haven't initiated hormone replacement yet, you do these for a week, receptor detox for the week before. If you're already on hormone replacement, then you can do it. So the typical time is a week, but you can be creative throughout a year. You could say, it's the spring equinox, and I think I'm going to do a receptor detox over the weekend. I'm going to eat impeccably, stand on my head, do yoga, and double my dose of receptor detox. And you can do it for a few days. So there's nothing set in stone, but the typical dose for receptor detox is a week. My beautiful friend, that's Lisa again. Starting dosing of hormones versus physiologic replacement. Do you have a preference? Oh, that's a big question I don't know. That's such an intense question. And do I have a preference? Yeah, stay away from the Wiley protocol preference, but there are people that love it. She puts people on very, very high dosages of estrogen. And in the olden days before tamoxifen, 6 to 8 milligrams of estradiol a day was used to treat metastatic breast cancer because very high doses downregulate the receptor. They don't turn them on. Yet I have some patients that swear that they're on the Wiley protocol and they love it. So Wiley protocol is kind of a mystery in the hormone community because she's so unique and it's such an outlier, and it doesn't quite make physiologic sense, yet some people swear by it. So never say never, as we got back to earlier in the conversation. But there are quite a number of people that have been on that protocol and gotten breast cancer. So that's worrisome. And I don't really know physiologic replacement. So I don't know that even concept. You're not giving physiologic real replacement because when you're older, you don't make hormones anymore. So you're really giving, you're replacing something that's gone. I guess you mean physiologic replacement close to what it was when you were premenopausal. The real goal is to get your follicle stimulating hormone under 25. That's really the goal of a great hormone protocol. That's when you know that your magic is happening. So any great doctor should be running your FSH, your follicle stimulating hormone, because that really tells you the physiology is getting younger.
We do have one question. If for our physicians that want to access this for their patients, they would go directly to the Biotics research page and set up an account as a physician. Do we know that answer?
They could set up their own account and they could sell these products themselves to their patients. You don't have to go through my account. Yeah. In fact, that's what you should do. You should make, you'll make a few pennies, a few rupees on the dollar if you sell them yourself, and please do. And open up your own account and disseminate, and so that you're passing something good forward. And for all your energy of sitting through this talk, you get to make a few pennies when you sell them. That's the way it should all be. We should all be a win-win. So anyone that's a practitioner should open up their own account and make their own money on it. And I want you to do that. And that would be a win-win for everybody. We're almost, we're going down here. I take Lugol solution, 1 drop once a day. That's hardly anything, but yeah, you wouldn't need to do that anymore. No. let's see, can this help with high DHT or high testosterone or hair loss? Well, that is a different issue because that's an elevated hormone. Um, the PABA and the boron and the control herbs might in an indirect way, but you really got to figure out what's causing the elevated testosterone. Is there adrenal hyperplasia? Is there polycystic ovarian syndrome? If there's an underlying organic disease, this isn't going to fix that. So, that's a question. It's hard to get thrown something when there's so many other issues that could be contributing to it. So this isn't something that normally lowers. Now, it will help hormones work healthier and better, but hair loss is a bugaboo. It's not an easy phenomenon to help. If it's mainly androgenic induced hair loss from the high testosterone, you got to figure out why that testosterone is high. I mean, that's an involved thing, but it isn't something that's normally designed to lower an excessively elevated hormone, but it does help keep your hormones more level. But in terms of if testosterone's really elevated, I just had a patient the other day. She's been elevated in testosterone for quite a number of years, and we got to really do some adrenal differential diagnosis in there to make sure that she doesn't have a late onset adrenal hyperplasia or something like that. So these are big questions that you need to do a big dive into figuring out what's going on. How can we access products for our patient population? Well, you can either go to my website and purchase them through my store, or you can, if you're a practitioner, go to Biotics and open up your own store, and they can help you with that, or you can just do it you can have one online, or you don't need to have one online. It's all up to you which way you want to do it, but you're going to want to get, if you do hormones or you do functional medicine, you're going to want to get your patients all on this, because endocrine disruption is a big part of what's driving so much illness in our country today. I mean, it really is. It causes adverse epigenetic changes. It causes problems with methylation. Half our population can't methylate. A lot of things that we're seeing with SNPs and this and that are they're set in the sperm and the egg and in pregnancy in utero from these chemicals. So this is something that we now need, and we're going to want our population to be on to help us out, because there's no other. What else do we do? Because it's everywhere. And we are getting sicker and sicker. Our children are getting sicker and sicker. We're living longer, but not as well. In fact, there's been insurance reviews showing that from age 18 to age 16, in the last 2 years, we've had more deaths than we've ever had, more than any other war. So our population is under tremendous duress. Chemicals aren't the only reason. Of course, there's processed food, there's the stress of the pandemic, there's economic stress and inflation, but hormones have a lot to do with it. Food's important, exercise is important, but not as important as hormones. It's not. Hormones are more powerful than anything. That's why you're younger when you have more hormones, and you're older when you have less, and you're more powerful when your hormones are more powerful. And when they wane, you're less powerful. And we slow down aging on people that are on the right balanced hormone replacement. But we're now seeing that some people need hormone replacement in their 30s. Harvard actually made a presentation at an endocrinology society meeting where they took young girls that were very athletic and worried about thinness and exercising and had very low body weight. They had a lot of anxiety, body dysphoria, eating disorders, and they slapped an estradiol patch on them. I've got an estradiol patch on right here. They slapped a low-dose estradiol patch on them, and they cyclically gave them some progesterone, and then they gave them the same estradiol patch that you give 50-year-old women, and they gave it to them for a year. The girls were 14 to 22 years of age, and the girls, it was 107 girls that they did this with. And at the end of the year, none of them wanted to go off the hormones. They felt so much better. They had much less dissatisfaction with their body, much less anxiety. They were happier. They had much less eating disorders. The hormone replacement in these 14 to 22 years old from Harvard pediatricians was extraordinary. Why would that need be because our receptors are dysfunctional from a dirty environment. It's a new way of thinking, and it's now been in my thinking, of course, for a while, and it might be new to you, but we don't have anywhere to deal with this other than, eating well and exercising, but it doesn't necessarily really clean off your receptors, right? I have been using iodoral, which is 12.5. What do you think about taking it at this dose? Well, we do recommend 12.5 milligrams usually once a week or twice a week because it's a high dose, 12.5 milligrams. But I don't know anything about your health or anything about your size. There's so many questions. You can't really just answer these questions without knowing a lot more information. So, but the reason I put 3 milligrams in between the two products is because almost everybody can safely take that, and it does do the work of protecting the architecture of the breast, the ovaries, and the prostate, and it does help the lymph flow at that dose. Are you collaborating with Norm Shealy? Well, I've hung out with him quite a bit, and we threaten to collaborate with each other. He keeps wanting me to go back and visit him. I've been so busy, my eyeballs are twirling. If I told you my schedule, it would be exhausting just to listen to it. Last question. I am confused. How can I balance hormones if I am blocking it with a prescription drug? If you're blocking it, blocking what? Are these supplements still useful with hormone blocker drugs? Oh, so you're on a hormone blocker. Well, that's a total, if you're on an aromatase inhibitor or tamoxifen, that's a different scenario. But you still have plenty of other hormones, and you still have some hormone. They don't block every single thing. So they still keep your receptors working, and you want your receptors, even if you're on aromatase inhibitor, you want your hormones working, We give a lot of guys aromatase, small amounts of aromatase inhibitors, and they're on testosterone. So that doesn't quite make sense. No wonder my head feels like an empty barrel, spaced out since taking the anastrozole. Well, that's a whole nother conversation if you're on, such a heavy medicine. And I am not a big fan of tamoxifen and aromatase inhibitors for women. Not a big fan of those, and there's plenty of things to do. In fact, I just lectured with Dr. Blask, who just did it. He hasn't published a study yet, but with the National Cancer Institute, sponsored by the National Institute of Health. And they were able to show that melatonin worked better than many of these things. There's so much out there, and I just can't answer it at this moment. So I know you don't feel well on those, and it's because hormones rule your brain, and they're blocked, and so your brain is shutting down a little bit for the moment. It's all reversible and it's all fixable, but those are really powerful drugs, and I wish you all the best. Oh, there's like too many questions. I can't answer them all. So because I have to let my staff go to sleep, they're an hour past me. And next week I'm going to see them in Charlotte. So I hope that you all found this exciting, and I thank you for being on here. And I really appreciate you spending an evening learning about this, and it's kind of been a mission. It's been a mission and an evolved with my life. So I hope it's helpful for you and for your patients, and I wish you blessings. And if you have really great stories or not great stories, send them to admin@drlindsayberkson.com so we can know about it. It's evolving. We've learned a lot, because the products have been available for a few months, and we're initiating a study, and as the study morphs and evolves, we'll keep you in touch with the study. But blessings to all, and thank you, Sarah and Karen, for helping out tonight. I really appreciate you staying so late. Bye, everybody.